I assume your presentation will magically appear.
Yeah, I think I can make that happen. So first of all, I want to say thank you to Dean Naira Woods, the wonderful staff here of the Government Outcomes Lab for the invitation to come here. It is really a pleasure and honor to be here. And I'm also really excited just having seen the distribution of the audience, because the what we're talking about today requires this kind of collaboration between these various sectors, as well as bringing people together with experience and knowledge to share in this kind of event. So I hope that what I talk about today is just going to stimulate even more discussion thinking along the many lines, the questions that we just saw pop up on the slides here. So the title here, what exactly is a public management emperor now wearing? That is a quote from a very well-known University of Oxford professor. Does anybody recognize that quote from research? So the author is actually Christopher Hood, and in 1991, he published an article called A Public Management for All Seasons in Public Administration. And the other parts of the question here was, so what exactly is the public management emperor now wearing? He said that it's not, he was talking about the new public management reforms. So I'm assuming some of you have heard of the new public management reforms, this wave of reforms that started back in the late 1980s, 1990s. And his question was, does its novelty lie mainly in presentation or in content? So I thought about this as we talk about SIBs. How much of this is content-wise really new and innovative? How much of it is in things we're doing and we're doing it a little bit differently? So I'm going to kick off just with this question. What is truly novel about social impact bonds? In the US, we're more likely to call it pay for success, so I'll be using these terms interchangeably. So, one thing, and this is, we're all here today, public-private partnerships is something core. They're the foundation in which we are building social impact bonds. But those have been around for a long time. In fact, if you look in the literature, you can go back four decades ago, and you can see writings that say, wow, this is going to take over completely government service provision. It's going to shift to all these, all kinds of names for them. People have heard of things like Quangos. Anyway, so that's been around for a while, as well as performance-based contracting. Maybe a little bit less than 4 decades, maybe more like 3 decades. But for example, in the 1980s in the US, we had a very robust system in our federal government of outcomes-based, performance-based contracting, and something that I was studying at the time. And so we have been doing also accountability for outcomes or trying to do that and talking about doing that for quite some time. So these are all elements that have been a part of public management for some time. Now, we are bringing in social impact investing. I think this is altogether something new that we are trying, but it also has components of things that we've done before. There's the private investors. So certainly private investors have invested in delivering social services before. We have private foundations that have been engaged in this, and philanthropists of various types. So that part is, again, something we've seen before, as well as public payers. So public payers for outcomes, that exactly was kind of how it was happening in outcomes-based performance contracting that we've done in the US and other sectors. So again, what is novel here? Well, one of the things that Christopher Hood said is, when he was talking about new public management, maybe it's not these different elements, but their intersection or their interdependence, newly introduced. And so that's something you might think about social impact bonds, is we're now bringing these all together, these components, into an instrument, which is somewhat new. And I think the other things that got me excited about this was this focus on impact, okay? And we're going to talk about that, I know, over the course of these next 2 days, and I saw it in some of the questions popping up there. When I think of impact, kind of trained as an econometrician, we think about impact as something very rigorous. So just to take the example of job training programs, An output of a job training program is someone who is trained, right? We can count how many people were trained. An outcome might be when that person exited the program, were they employed, okay? But just because you were employed at the time you exited the program doesn't mean that is causally attributed to what happened in the program. It might be that you were called back to work from your old employer, or your friend got a job and helped you get into the firm. An impact in that case would be if that person during the training got skills that made them more attractive to the employer, and the employer hired them because of their skill gains through that program. We could directly causally link that. So that's when we think about impacts, we think that is a real contribution or value added of government. I think we've been trying to get at that for a long time. So I was excited about social impact bonds. We're actually going to pay for impacts. We're actually going to pay for things that government made better. So that's ideal, right? The other thing that's really important is accountable for outcomes over the long term, right? So there's this aspiration, which a lot of people in this room are working hard to figure out, how can we project outcomes, impacts, how much we'll be saving, and then plan in advance for how we will pay for them. So we'll be talking more about that, I know, like I said, today and tomorrow. But so this is what I think, when we think about what's novel, pulling these together in some of these elements here. So now, again, if you look in the literature, this isn't, I think, the promise, right? That social impact bonds will both reduce the cost and risk of government funding for social programs, okay? And I think that's a question that we haven't answered yet, if it's actually delivering on that promise. And hopefully we'll hear insights over the next couple of days of how that might actually be more attainable. There are major challenges in living up to this ideal, right? If we think about these particular components of social impact bonds pay for success. So the other important kind of dimension of this is our intention to focus on prevention-oriented programs. And then the idea that the funds for public payout to the social investor are going to come from these savings that we're going to realize in the future by government. So forcing us to think in the future. And that's really important, right? Too many of our programs or policies in government focus just on, well, what can we accomplish and demonstrate results today? Because, we're going to have to deliver this annual report. Or the election, campaigning for elections start in 2 years. Or the public, my ratings depend on me showing concrete achievements. So this is exciting too, the idea that we could be projecting what we will accomplish into the future. Someone other in office at the time might ultimately get kind of credit for that, but we're thinking forward. But that's hard, right? Because we need to be able to rigorously measure impacts and project what those will be in the future. And that takes data today and modeling and things that are very challenging. And then on top of that, we also need to monetize those savings. And I think one of the things we've learned in impact evaluation over time, there are things that are very difficult to measure, but they can be sometimes the most important impacts, right? So it's easier to measure something like earnings, which already comes in some currency unit. It might be more challenging to measure things like that would have happened that aren't happening, we don't think. Or something like improved, if you think about a person who, for example, is now employed or is better educated, yeah, they might be earning more, but they also might have better social function in other ways. They might be healthier. So those are the harder things, right, to monetize, but they could be real impacts of our social programs. So these are challenges for us. So is this a revolution? Is this potentially a revolution in the way we do things, the way we think about things? So one of the things that got me motivated to want to do more work on this was I was in a roundtable discussion at the Association for Public Policy Analysis and Management, which some of you may have attended or been members of at this conference. And so this was a discussion back in 2015, and I actually wrote some of these things down word for word to preserve these quotes, because some of them pretty shocking. So this was one of them. It says, Government needs to get out of the investing business and get into the buying business, just paying for results and not worrying about how we get them, right? So government, get out of the way. You don't need to deliver services anymore, provide services. Let us do it, and you just pay for the results. That's pretty dramatic. That would be kind of a revolution if government wasn't doing direct provision anymore and just only paying when they got results. Another one was government capacity to be an intelligent consumer of outcomes is low. So some of my colleagues I'd worked with in government were in the room, and I saw like jaws drop. Yeah, that's pretty harsh critique. And you notice the word consumer, right? So thinking of a government as a consumer of outcomes. Again, going along with those lines that government should just be paying. So, I mean, I think that I'm going to be talking more about government capacity. Government capacity is critical. And at times, government capacity may be, in fact, what another person said, the limiting partner here. But there may be real reasons why we might not be able to go forward with this everywhere. We'll be talking about, people were talking about development impact bonds too. So yeah, these are provocative, and this could potentially be something we think of as revolutionary. But I also think that we have decades of research to draw on in terms of addressing some of these challenges that we face in making them work. So I would argue, and I put this out there right front, that this is not an instrument that is going to get government out of the way and just let others take over. In fact, the government needs to be a very strong partner and needs to have strong management capacity. So I think the needs for the government having strong capacity are intensified in these applications. And we actually know, this has been long documented in the public administration literature, that because these are very complex arrangements, performance management and contracting are hard to do, we in fact need to build that capacity internally. We're not outsourcing a function of government in doing this, or we should not be. It is sometimes challenging even just to align diverse public and private interests and goals. And some of you may be encountering this in your own projects. This is long been known. In fact, things we try to accomplish in our public programs, we don't necessarily, even in legislation that provides for that government role, it sometimes has conflict inherently in it, right? For example, trying to serve people most efficiently, but also be equitable, right? There may be tensions in doing that. It's also the case that it requires a high level of technical and operational skills, real skills, for managing complex contracting structures with an outcomes orientation. And you can say, well, turn that over to the intermediaries or give it to the professionals that are experienced with this. But ultimately, government has to be accountable, right, to the public for these outcomes. So I don't think it's something we can just turn over. In fact, if you look back in the literature on previous kind of pay for performance efforts, they comment that there's been too much focus on the technical skills and not enough on some of the other things that we'll talk about. The other thing I think is really important to mention is that this issue that big data is going to solve our problems, right? So it is great that we have these massive capacities these days to store data, to link data, to analyze data that we've never had before. But just having that capacity and having the data do not help us get better at knowledge of impacts. We need theory, we need models, we need that kind of work that a lot of you, I think, are working on to really understand whether we're getting closer to impacts. And then this idea that it's not just all about the technical. We have to critically attend to the informal aspects. We know cultural norms and ethics all play a role here, but also that there are political and strategic considerations as we bring these diverse partners together, right? And so some of the work that's been done, Alec Fraser's here, Stephanie Tan's here, and their colleagues, and kind of recently summarized one of the recurring themes that they were finding and looking and summarizing the knowledge to date on social impact bonds is this challenge of competing public and private values, or different logics or assumptions that people bring to the table to try and make this work. So I think this is, it's healthy for us to be having these conversations, to be all together in the room, and we need to attend to these things. It's not just all about the technical details of the modeling and contracting that we have to reckon with to make this work. Now, I would like to say that I think the United Kingdom, as you know, they have roughly 40 SIBs in development or rolling through. We have about half as many in the US, and then there's scattering of operational SIBs all around, but they've been running ahead for a long time in terms of developing this public management capacity. And so I think we have a lot to learn from the Government Outcomes Lab, from those working with them in government here. Just the fact that you had this cabinet office commitment and resources, I think has helped tremendously. It's only recently in the US that, just with our Bipartisan Budget Act, that we actually finally, earlier this year, did this. And so so if you look at I just took some rough numbers from what I could find publicly, and the UK has about double the central government funding for a population about 1/5 the size of the US devoted to this. So I think it really makes a difference in building capacity. And you have here the Government Outcomes Lab, which is actually actively working with public sector organizations to help assess the viability of SEBs and drawing on this rich expertise that we have on these different components that exist. Good finance, assisting nonprofit sector. You have also this really challenging part where I was talking about trying to think about financially modeling in the future and the rigor of the data and methods we need. You have things like the unit cost database, support for undertaking the very challenging work of cost-benefit analysis. So all these things are really important. And I would say in the US, our challenge has been that our support's been very fragmented, and I worry that this leads to equity issues. So, only areas with already capacity, or maybe luckily near Harvard University where they've developed their own kind of lab there or had ties there that they can draw on that. So I feel like if we're really serious about this being a model that could change, especially where change is needed, where they're lacking in funding and lacking in capacity, then you need more kind of centralization support. So I think this is all very positive and also suggests why the UK has kind of been leading us here. And so it's great we're here and here to learn. So I'm going to shift now a little bit to talking about some research that Sarah Kaborek, who's right here, she is a doctoral candidate at Vanderbilt University with me, that we've been doing. And as I mentioned, the US is behind the UK in many ways on this. So we are only really in the very earlier stages. We had, you've heard there's been a few SIBs that have progressed and moved on, but for the most part, our federal government is finally just taking a more serious look at this. And so a lot of our projects are still in the feasibility stages of development. But I'm going to say that I think this is actually a really useful place to be looking at them, because it's in this stage where we're reckoning with all these challenges we've been talking about. So as I mentioned, just earlier this year, our Bipartisan Budget Act finally included $100 million, and it took 4 years to get that support passed. So what we're looking at is going back a couple years earlier, when the US Department of Education in fiscal year 2016 put out an RFP, request for proposals, for preschool feasibility pilots. And so what we did was we took these, there were 20 applications total that they received. We looked at both the funded and unfunded applications because we were interested in not just seeing, what got funded or what happened to those that got funded, but what about those that didn't? Did they keep working towards these similar goals, right? Because there's a lot of elements here they've been trying to do for a long time. Did they give up if they didn't get the grant? So we coded and analyzed the data applications, looking at trying to understand, okay, here's the ideal. What were the reviewers looking for? We had the reviewer comments, and we also had the details applications. Then we conducted interviews. We were able to reach about 60% of all the project leaders, both awardees and non-awardees, working on that all this summer. So I'm just going to share some things. So first of all, our core research questions. And we're interested in knowing, so what motivated the grant applicants to pursue this? Why did they want to pursue a SIB or pay for success? Why did they see us as promising for achieving their short and long-term preschool goals? And then how did these proposed feasibility study features align with this ideal of what a SIB or pay for performance would have pay for success, and then how was this reflected in how the applications were rated, and then what is the status today? And do we see, is what they're learning from the feasibility study pilots or their efforts, are they thinking this is a promising strategy, and what kind of lessons have we learned? So first of all, why pursue pay for success? The primary motivation for literally everyone we talked to was more funding, right? And so this idea that they're constrained. They want to expand preschool. They want to do work in enhancing the quality of existing programs, but they're not finding the money. In fact, there's some literature, existing literature has also cited this, the fact that the deep recession, which we experienced in the world, might have actually been a catalyst for this actually instrument or tool taking off, right? A lot more constrained governments looking for ways to cope with financial constraints that they now face. Others basically said, no particular lure beyond funding, and also that this is way more complex, way more problematic than their typical strategies. So, they may have, there were definitely among these applicants, those that had already built strong public-private collaborations. They had funding from foundations. They were mixing. A lot of them were putting together money from lots of different pots to do this. They were drawing on public money. They were drawing on private money. They were drawing on donors, philanthropists, others. So a lot more already doing that. And this they saw as a more complex or challenging way to try to achieve this goal. But, it was another shot at more money, and they wanted to do it. Also, a lot of them, even going into it, did not really see pay for success as viable, and especially not as a long-term source of funding. So, during this time, you're more constrained. Hopefully, things are going to change. As the economy will have more investment. One of when you see quotes here, they're quotes from the interviews. One of the interviews pointed out and said, there's this unavoidable leakage out of the system because the way this instrument is designed, you have to pay a risk premium to the investor. And they said, that's not sustainable. We can't afford that risk premium. But, we're going for this to learn to see if this is another source. Could it possibly work? Others talked about it as bridge money, and if through this work, we can actually demonstrate that there are benefits of expanded preschool, then we might get more people on board and transition to, a regular fee-for-service, or maybe even a performance-based contract, because maybe we'll learn some things in the process about how we can do that better as well. So, it wasn't, what I was hoping to hear was like, oh, this is so innovative, we want to try it, or we think we're going to be spurred to innovate more, or we're going to be doing things different. That really wasn't what came out. However, is there potential for this? Should we be cultivating these SIBs and maybe kind of bringing people on? So I think one of the key things that we see, for example, in the US law is there is this intent, right, to fund programs with strong evidence-based models, high fidelity to those evidence-based models, and also with well-defined outcome measures. So this is a quote from the text of the US law. They want to fund projects that are more likely to produce positive outcomes for both service recipients and taxpayers. So this really came clear in the application reviews. They were looking for these elements. Those programs are already pretty strong. And so most of the funded applicants were more likely to have solidified partnerships with intermediaries or evaluators. They had already engaged in prior evaluation work with their partners, maybe the evaluator, independent evaluator they had identified. And some even had previous experience operating a pay for success, or SIB. So they were looking for those with a strong foundation. And I think this has implications for how government support for capacity building is allocated. And so this is a kind of something for us to think about. Should resources go to partnerships like this with the greatest existing knowledge and capacity for executing a PFS? And probably at the early stages is what we want to do, right? If we want to see if this can even work out, we need to do this. At the same time, there's this ideal, I think, that we would be newly creating capacity, spurring innovative models. So is that something we intend to do? And if we do that, it may require a lot more investment in this kind of capacity building. I was talking about. So what were the project leaders' reflections on collaboration capacity? So here's some quotes. Pay for success is hard, really hard to get all the players on board. Here's one. When people are wearing multiple hats and trying to make things work as they currently work, it's more difficult to get them to think out of the side of the box and to be able to devote, a lot of time to a complicated concept when you don't know if all the time energy is going to be fruitful. So and I think many of you have experienced this in the field, right? This takes a lot of work. It's not just I'm like, oh, we're going to come in a couple months, we're going to have all this lined up, we've got intermediaries, and we got the model set up. It takes a couple, they're working through this over a couple of years, and a lot of them are still feeling challenged to get to the point where they think they could actually make this work. I found this quote pretty interesting. We're going to move from a feasibility study to a pilot. We're not going to need more money. We need more people hours, staff hours. And so where do you see this as being feasible? This idea that, again, recognizing it's not just, bring partners together. It's like, no, we're going to have to be working harder to make this work. And there's a lot of learning that has to take place there. And people have to have time and be motivated to invest in that kind of learning. And then there were lots of discussion of political concerns. So I'll have a little bit more on this later. But this is the one that we heard, for example, I was citing Alec Fraser and colleagues' research. There's the question, should investor benefit from societal ills, so to speak? All right, so this is the underlying tension in public-private values that doesn't always get articulated, but this concern about having the government pay the private sector for these outcomes. Okay, so what have been some of the challenges to progressing? So the single most common challenge was actually identifying a likely prospective payer for the outcomes. So again, these were preschool pay for success programs. One of the questions was some of the project leaders were county governments. And some were state governments, and some were other types of kind of hybrid organizations. And the challenge was partly so who should be the payer? Do we think the savings are going to be statewide? Then the state should be the payer, not the local government. Here's an actual quote. No one wants to pay for a kid who isn't going to be in their district. This idea that kids move, right? There's mobility among families. So we started out, well, if that kid leaves, someone else is getting those benefits. I don't know I pay for the kids that stay in my district. So that's I think a real problem, right? So who should be the payer? I guess the slides aren't quite showing there. The other question is it's really hard to find that payer, and if you don't have an end payer, you've got nothing. Okay, so. The other really important constraint we were facing is that there was a lack of options or choice in experienced intermediaries and also evaluators, more so the intermediaries though, which made it difficult for procurement to be competitive. So many of these governments, local, state, they're required to do competitive procurement, right? If you can't get, bidders, multiple bidders and intermediaries, qualified bidders, it's hard to do that. So they were stuck at that point. In fact, there were only 3 projects of the 20 that had actually contract identified an intermediary. Others mentioned that, and so it was the same intermediary for all 3 of those projects. And others had mentioned that price of that intermediary was cost prohibitive. And without competition, so we have a problem possibly of a monopsony, right? And this is something that if we are going to be more efficient, or I saw one of the questions on there, how can we bring the cost down, right, of arranging these contracts? We have to get at this. There has to be competition, or has to be enough capacity among the other kind of project components there. And this also has implications for government role, and this is US, but for anywhere. So would these projects potentially be more successful if the US did what the UK was doing and provided more of this technical assistance? In fact, Ryan Martin was on a conference call on a meeting we had yesterday via conference, and he's in the US government, and he was basically saying that it might be the case that we won't even require an intermediary, and we might try to be providing that kind of assistance. we're short on intermediaries. And then actually this came directly a quote from one of the people in the project said, I think it would be incredibly helpful. If the U.S. Department of Education wants to continue, they need to create a technical system resource for us, or a contract model that all their grantees would use. So the other, I think, I mentioned the payer, finding the payer is a challenge. The other thing was, of course, the financial modeling. So I think there's some real pros to trying to do this, to trying to go through this process of seeing if we can identify impacts and financialize them. So first of all, I think it could help us with this perennial challenge of the need for us to focus more on longer-term future public sector gains when we decide what should the government be providing and investing in. So some of you may or may not have heard this description of the time-shortening disease. It comes from some couple decades ago again, but it's the phenomena in which public managers focus on the short-term, more readily accessible outcomes, right, or measures, performance goals, to neglect of the longer-term goals, not only because of this kind of political pressure to demonstrate results quickly, but also because it's just hard to translate your goals into your shorter-term goals into longer-term goals. The other, big concern is that when you look at the actual data, look at the research, when we do measure impacts and correlate them with outcomes or outputs, sometimes those correlations end up being negative, right? So an example I used earlier of the job training program, I could quickly get someone placed in a lousy low-wage job. I could count that as a job placement, but they might not hang on to that job then. If I spend more time and more resources trying to get them skills to get a better job they're better matched to, they might hold on to that longer, right? So that person, though, you might not fully see those gains till longer, right? They get into a job, they have entry-level wage yet, but then they build on those skills and grow. So that could be a real advance if we get us to be thinking more about future public sector gains. And in fact, it was actually pursuing program leaders to establish data sharing agreements, make progress towards tracking outcomes from early childhood into later outcomes. So it was a motivation to do that, which I think is positive. So one of the grantees said, we now have new technology and assessments that replaced a system where previously all the data lived in different silos or places, and we had to link children's records one by one. Okay, so these are, even just trying to do this is pushing some advances here. Others saw this opportunity to gain tools to look at our investments in a different way, hone in on best practices, and really think about what we could be doing better. If really thinking about how we might be saving things in the long term, this is an opportunity to look at what we're doing more carefully and think about what are those drivers of improved savings or improved quality of programming. At the same time, I think we're coming up woefully short on financial modeling evaluation. I hope some of you here next couple of days are going to show me examples where you've gone beyond some of these shortcomings and can share that with the rest of the world. The investor's repayment is contingent on evaluation methods that I feel like are falling short right now of the impact and cost-benefit analysis. This aspiration to be a social impact bond, not an output bond or outcome bond. I found vague references. We found vague references in the applications and interviews to types of methods that aren't getting an impact. So only one noted the potential to conduct a randomized controlled trial. The term impact was often used loosely. For example, we had one person say, well, no, this is really evidence-based. We ran a logistic regression. And the logistic regression there was no comparison group, right? So how do you construct a counterfactual and actually define an impact from that? So I think part of it is I feel like we will be coming up short. We'll be back in the same challenges we had before. And in fact, Gordon Berlin, who worked with MDRC, people familiar with the Rikers Island SIB, said this very explicitly. He said, one strategy for investors to realize more secure returns is to use simpler outcome measures and methods that this is his quote, may misleadingly provide only the illusion of benefits and savings to government entities. So I feel like if we go forward and we don't hold ourselves to the higher standards, we're going to be at risk of these same challenges we've seen for decades now of trying to get over this problem. And of course, this is hard. I mean, I'm not saying that I have all the answers. I've often said that the holy grail in public management is finding the short-term outcome that correlates strongly with the long-term impacts. And if by doing all these projects, we get some info on those indicators, those short-term indicators actually correlate with long-term impacts, that's a big achievement. So I'm not saying this isn't a valuable enterprise to go through this, but it's hard. And those financial models and contract negotiations have to account for all kinds of contingencies over a span time of, maybe 8 or more years that people are thinking. And this is how do you anticipate legislative change, which is suddenly going to make it hard for you, the government, to pay the investor, right, afterwards. So, for example, in our situation, we found some state and local public financing rules and mechanisms that were precluding viable payment plans. So, for example, I mentioned the issue of needing competitive procurement, or just other rules within. So, we talked to state PFS leaders who are saying, it's just not going to work out. Or one particular locality that said, we thought we had this figured out, and then last year our state made a change, right? And how they're paying for preschool, and it's not going to work out anymore. So this actually quote comes from Project Intermediary itself, said basically the projects rise or fall on the political will that is behind them. So in the case I was just talking about where there was this change, the person said, yeah, there was one person who ended up driving that decision in the legislature and did not go our way, and that was it. The politics in that case dominated. So what did the applicants think? So we asked the applicants whether they were funded or not. At the time you applied, what did you think the probability of this was actually going to lead to a viable, active social impact bond or pay for success project? And then we asked them at the time of the interview, so now 18 months later, where are you? Do you think that you're more or less likely? And so these were the kind of the numbers they gave us. So this is what we asked them exactly, and we asked them to use the spectrum 0 to 100%. So there was a wide range of responses, a low of 5 to 10% or a high of 80 to 100% that they thought that it was going to come to a viable working PFS or SIB. Interestingly, the funded applicants, who, as I said, were more likely to have established, public-private partnerships, they had intermediaries in mind, evaluator experience, may have had actually run a PFS before. The funded applicants actually were less optimistic, so less than 50-50. The unfunded applicants were a little bit more confident. But after going through the pilot, only one of the funded applicants felt more confident that they would actually progress to a formal arrangement. And 2 of the highest rated applications, so both of these were funded. One of them had actually, the project leadership had already run a PFS. And then the other one was extremely knowledgeable, just from the comments. And both of them had rated their chances of success the lowest, 5 to 10% or 25 to 30%, and they were not more confident 18 months later. So after working it for 18 months, they did not feel more confident they were going to work out, and their probabilities were pretty low. But at the same time, so we asked them, well, if not the SIB or PFS, then what? What would you be doing? And so the kind of hopeful side is that a lot of them were suggesting that there were things that they were gaining. So going forward, this is scaling up an early learning program with area philanthropic organizations, something they've been aiming to do. They felt like going through this, they were maybe going to be able to better convince their potential funders and school districts to come on board. And they said, we don't necessarily have to reinvent the wheel entirely, but we're trying to find a way to expand it here in this other location. So they felt like maybe they didn't really have to go all the way to SIB PFS, but some of the things they were doing were helping them to maybe bring some of these other philanthropists and others on board. Another one, a couple of them talked about this idea of taking this concept as a blueprint for their public and private partners, and then this idea that they're still going to try and track students from preschool into their college year. So maybe not in the context with a social investor and a payer, but they were going to use some of the elements of that and move it forward. Others talked about in financial terms. It changed how they were thinking about how they can convince others to get on board and fund preschool. So how can we sell the benefits of our program to potential funders? So one project says PFS was priceless for this effort of tying data on individual children to student readiness and these other longer-term outcomes. So it was pushing them to do things, to think about things in a different way, to maybe think of from the other, why should I fund more preschool slots or your efforts to increase quality? How can you convince me? Pushing them to think about that, think about their models, and think about how they justify others coming on board. And again, this idea of this is a proof of concept, with the idea that maybe, again, we don't see social impact bonds as a long-term source of funding, but we feel like if we go through this process, we get some proof that this works, we get convincing evidence, and then maybe we can convince our state, yeah, you should put your money here. You should be funding this. And I think that kind of raises this question. Is this something government should be doing anyways if we've got these evidence-based models which have demonstrated impacts? So, are social impact bonds and pay for success just another wave in the tides of reform that ebb and flow and is just going to recede? That actually is a quote from Paul Light, who wrote this book, Tides of Reform, about public management reforms. That's something maybe we'll be talking about again in a couple years. Is this the big thing that's going to continue or not? So what do I think? So I do think there's some really important positives here. CIVs and Pay for Success are bringing new partners to the table in social services provision. It's prompting them to more carefully consider the strengths and weaknesses of the models that they've been doing public service provision. And then also, how can we better assess and ensure quality and impacts? So we've been trying to push the government to do this a long time. Maybe this model will bear some fruit in that regard. At the same time, I think there's a lot of caution warranted. If we really want this to be something innovative and different that pushes government on these fronts, we can't shortchange or compromise on some key principles. Like this idea of that we are not going to compromise and do short-term gameable outcomes. One concern, for example, in preschool pay for success is this use of a short-term outcome of how many kids needed special education services. That's a very gameable outcome. Kids can just not get their special education services. There's too much in literature to show that if you push too hard and the stakes are too high for people, that kind of behavior can happen. In fact, I think in the preschool pay for success feasibility pilots in the US, they explicitly said don't use that as an outcome. Okay, that's a short-term outcome. It's not an impact. The impact is understanding whether those kids, if they had disabilities or challenges, that those were overcome through preschool, and that they did not see that in hampering their achievement later, right? And then, so we don't want compromise just to seal the deal, to make it work. And then, also recognizing, like I said, government needs to be a strong partner, invest more in capacity building, and in part because it still carries its primary responsibility to ensure that these public-private partnerships are politically accountable for public services delivery. We are vulnerable populations here, right? And we have to uphold other values like social equity, equality of opportunity, representation. So I think we can't, the government has reasons to feel this is risky as well, right? And we have to respect that. They are accountable to the taxpayers, they're accountable for upholding these public values, and the opportunity cost to them of putting their political capital behind these models. I think our current funding in the US falls way too short of the need for this kind of capacity building. And I think we should also think about this, whether or not we should be extending these kinds of supports more broadly. So I like the kind of framing of the Government Outcomes Lab as thinking of outcomes-based commissioning. Regardless of whether we ultimately get to a whole lot of functional CIBs or pay for success, if we push the government on some of these elements to improve, I think that could be a really important accomplishment. So that's kind of my concluding thought. Increasing public-private capacities for more effectively serving vulnerable populations and holding programs accountable politically and contractually for longer-term outcomes and impacts. If we achieve that, I think that would be a major public management contribution of these efforts. And I'm going to conclude at that. Thanks.
Thank you so much. No, I think you
Let's
need to stay here,
okay.
because this audience
You'd be accountable for what I just said, right?
is ready to grill you now. So may I remind you that we are live streaming this session, and if you want to look at it again or share with colleagues, there is a link to the YouTube channel on our Twitter account, or is that it? On Twitter? Yes. So we have about 25 minutes. This is a lot of food for thoughts, and we have a microphone, 2 microphones going around. So I'm going to take 2-3 questions at a time, and move on from there.
Thank you so much, Carolyn. I found that really stimulating. I was just thinking back to the slides at the early stage of the presentation where you talked about the intersection between public-private partnerships, social impact investing, and performance-based contracting. And you talked about that interconnection potentially being the new, if there is anything new in this space. I was wondering if you could maybe talk a little bit more. I'm particularly intrigued by the interaction of impact investors on the performance management piece, and whether you could reflect on that a little.
Yeah, so I think that...
Can I take that 2 or 3?
Oh, yeah,
Otherwise,
perfect, sure. I'll try to remember them, yeah. You can help me.
If there is.
Actually, on that same slide, I'd like to ask Sue from Keynote, I'd like to ask what
lessons were taken from the decades of performance-based contracting very intentionally into the pay for success movement in the States? And was there crossover between professionals between those two, between institutes that were specifically trying to understand the effectiveness of performance-based contracting?
Maybe we want to take notes on the questions.
I think I got
You
the
remember.
first two. If it gets more complicated, I will be taking notes.
I'm Deborah Duran from New York University. I thought your comment about where the U.S. market is a really interesting one, and I'd like your thoughts about how we move from that more fragmented space, given that so much of our social service contracting in the United States is actually done at a local level. The federal government does very little in the delivery of social services. So are we just in a system that is going to mandate lots of independent government agencies within municipalities and states learning this over and over and over again? And that might have implications for other governments where, in fact, the federal government is not the major provider.
Okay, stop at 3. Okay, so let me take the first two maybe together. So I think, again, in terms of the intersection, so like I said, all these components have really been there, but we haven't, I think, had the real novelty of this idea that the public payer is going to pay back the social investor, right? I think that's the really big innovation. Whereas I think there was a comment yesterday that someone made in a meeting talking about how they tried to get a foundation interested in being kind of the social investor, and the fact that they would be repaid back, and they were saying, well, we don't want to be repaid back. That's not what we do. We're trying. We just give money, right? And so, I mean, that's kind of the way it's been, right? The private philanthropy has put money into public services, but in these arrangements, they're contributing because they see the value in meeting the needs of these vulnerable populations, or trying to get us to focus more on preventative services. So I think this is the really unique component of it. And then also this idea, so to bring in the second question, what did we learn in the past from performance-based contracting that applies here? And I think one of those hard lessons learned of the past performance-based contracting, and so Gwyn Bevan, some of you may know, he had this role in the National Health Service in the UK. He was here a couple of days ago when we were talking, and I often cited a piece of his research in this where they were, I remember the quote, they were hitting the target, but missing the point. And this was where they had emergency room waiting times, right? So they were trying to bring down emergency room waiting times. This is a short-term indicator, right? With the idea that if people aren't waiting, they're getting seen sooner, they get access to quality care faster, and it has this benefit down the line of a healthier outcome. They'll come back to the ER less and things like that because they'll have been better served. But the way they managed the pressures of those targets is they kept the ambulances waiting with the patient outside the hospitals until they knew they could meet that four-hour window. So they were hitting the target but missing the point of getting people into see. So this is one of the hard lessons of our previous performance-based contracting. We have these short-term outcomes. Those who are working towards them will do everything they can to meet those targets, but sometimes at the cost of actually achieving the value they were aiming for in the first place, right? So I'll quickly get people placed into jobs if the target's a job placement rate, and not worry about the quality of the training I'm giving them, or whether that's going to matter to that job they get. So that was a hard lesson of our performance-based contracting. And the other hard lesson was the higher the stakes, the more likely people were to engage in these gaming behaviors, right? So like in education, you all heard about, I was on a National Academy of Sciences committee that looked at all the literature on this. And one thing that clearly came through is if you want to move short-term performance levels of students, achievement levels or performance on tests, you really work hard on teaching them to the test, right? And that can actually come at the detriment of their long-term benefits, learning. So this is one of the big lessons of performance-based contracting, that what we are contracting on matters a lot. The other challenge was, and it's relevant to this, is this challenge of where there are unforeseen contingencies that happen in the public sector and things that again, biennial, if you do your annual budgeting and there's a recession and there are cutbacks, that may change, the resources you had, whether or not you're going to be able to deliver the same types of services, whether you're going to meet those targets or not. Or this issue, and I do not know what's happening here now, so I'm sorry. So these kind of challenges that if you, that are going to come up, right? It's the public sector. You're responsible. There are a lot of different things that are going to come into play, economic, political, social, that could change over the course of this very long time you're going to be trying to achieve these savings, realize the targets, and pay back the social investor. So I think those are some of the lessons we've learned from that, and there's more. So I do have a paper if anyone wants it, and we kind of review some of those key lessons. The other thing is that this is dynamic, right? Contracting processes are often dynamic, as is performance management. So we might go in initially thinking we've accounted for all the contingencies, we've designed the best possible contract, but once it's activated and things change, or people maybe learn how to game those measures, we may have to reorient that. So there may be no stable kind of ideal contract that everybody should model that emerges. And going to the other point about the fragmented problem of fragmentation and capacity building in the U.S. So as many are aware, we often do things more decentralized in the U.S. States and localities sometimes emerge as the leaders or are necessarily working in these arrangements. What I was hearing from those who are trying to do this is that, kind of what you were mentioning, this is really hard work. It takes knowledge and skills. It takes a lot to develop that capacity in-house. We wish we had more guidance. We wish we had, for example, some model contracts, right? And that's something I think that you've been trying to do in the UK, right? The Go Lab has been working on that, trying to help with that capacity. That's sort of missing, and it's also because they don't want to keep reinventing the wheel. Now, at the same time, I point out it's a problem. I thought that there's so few intermediary options in the U.S. Because when I was looking at the contracts, the ones I had identified an intermediary, and it was the same intermediary, the stuff in the contracts was boilerplate. The intermediary was giving every project the same things, same logic models, same same outcome measures, and that is not realistic, right? For the reasons you mentioned. All these localities, they're very distinctive, the types of partnerships, what they had access to data. So that wasn't helpful either. The intermediary just giving boilerplate to every partnership they're working in. If they're doing their job, they're supposed to be understanding their context, understanding their specific challenges. So I think that's something where I feel like why, for example, the government outcomes lab is so helpful, because you're actually engaging the clients, you're looking at the different contexts, not just, and I think you've mentioned that multiple times, you're seeing quite the diversity, right, of models that are viable models that are coming out because of the fact that this is complex, what we're trying to do.
Thank you. Other questions?
Hi, I'm Chi Hung. Thank you for a presentation. And I think I really like the point about reminding us that to keep the horizon on the longer term outcomes. But I think one of the lessons we learn here in the UK, especially because we use SIPs to target a lot of social sector providers. And when you speak to the provider side, what seems to be missing is the kind of patient capital. So the types of capital that's needed, that is long-term, that can accommodate risks and uncertainty. Now, if the government is short-termist, and we are starting to find things like the ones that you're reporting about gaming, with investors pushing on the shorter-term outcomes, then what are your reflections on? Is that a symptom of this type of contracting, or is it because we haven't attracted the right investors yet into the market?
That's a really good question. I mean, I think in part it relates to this natural tendency, right? Everybody wants to minimize risk in this context, right? The social investors have incentives to minimize risks. The government clearly has incentives to minimize risk. But as you mentioned, quite often there's a lot of risk, right? It's inherent in there. So I think that is, my biggest concern is that in the inherent incentives to minimize risk, we compromise, right? We come to these trade-offs. And so, that's I think a context by context almost decision, because as you mentioned, the other concern is that these are vulnerable populations, right? And we don't want to see the kind of gaming that then shortchanges the population. Because if that's what happens, if we don't achieve kind of what I was saying at the end there, is that what we really end up doing is building capacity for programs to really work on being more effective as well as more efficient, those kind of compromises don't go towards that at all, right? So we won't actually get those benefits that I see. So I feel like, and this is the hard thing, right? So if we acknowledge the risk that's present, right? And you appropriately compensate the social investor for that risk, because it's over a longer time. We know there's lots of contingencies. That makes the cost higher, right? And that makes it harder to get to the deal, right? Because I heard that too from government payers. We can't afford that. We're not willing to make that commitment now. We don't think so. That I think is the hard thing. Maybe we'll see some places where that's actually going to work. I'm also really concerned about, as we push into the developing economies with this model, in part from my own experience there. Again, some of the challenges to improving models are inherent in context. So I worked with an educational leader in Malawi who's talking about the challenge of supply of teachers, right? They don't have, especially in the rural areas, they don't have enough individuals with education level above, high enough above even, primary to staff their schools. So how is bringing a social impact bond, right? going to change that? How is that going to drive innovation? So I think we also have to be, that's a place where there's even less capacity, right? Risks may be even higher. So let's just be real cognizant of that, right? About what is really viable and not compromise by pretending the risks are lower. I think that was like Gordon Berlin's point, right? Let's not create the illusion that we're doing this the right way, by making those compromises. So I know it's not a fully satisfactory answer to that question. But.
Yes, can I have one question? 2 questions? 3, okay.
Hi, my name is Patrick. I'm from Belgium. You mentioned in your presentation that many of the government procurement didn't succeed in finding enough competition to place their project. But in that prospect, I was wondering how many projects are launched out of a project idea from one of the providers and therefore limit the market, and how many are really an open call for a very clearly defined social problem.
Okay. You want to take the other
Carolyn?
2? Yeah.
Hello, thanks very much for your presentation. I'm Callum Miller from the Blavatnik School. I wanted to come back to a point you just made about unforeseen contingencies in the public sector. Because, of course, the bond structure is intended to be slightly more long-term. And I wondered, in the context of your opening challenge about whether there's anything new about these types of contracts, whether you see any additional benefit to them in binding in the partners to a longer-term commitment that helps ride out some of those contingencies and or provides a stronger commitment device.
Salama from Abu Dhabi. We are starting recently talking about, the social investment or impact bonds and, the social businesses and stuff like that. So we are a very novel from that perspective. Like it's like 2000 in UK, similar 2000 in UK. So what would be your advice for us? What would be the main success factors for us to proceed on that domain?
I will ask you to have a short answer to that question.
What was that? I need to.
Yeah, no, that's a very long, you can come up with a very long answer to the question.
Yeah. So let me see. Let me start with the question about the kind of longer term partnerships and bond infrastructure. So it was kind of interesting yesterday when we were having this conversation. I mentioned Ryan Martin from the U.S. government was on the phone, and he also, besides saying that, well, maybe we don't need to necessarily have any mirrors, he also said, maybe what they were thinking about was more of like a social insurance program, right? Which is really saying, like, if this really is too hard to do in this context, we need to think about more focusing on how can we, right, achieve this idea of really wanting to look out, pay for, motivate, focus on longer term outcomes. He was suggesting, well, maybe we instead have, I didn't know what you were suggesting, but insurance where, so we go ahead and make these investments, but if we don't necessarily achieve that, there's, or there's support. I don't know if anyone else, do you remember his full details of his kind of social insurance model? But I think it's along this lines. We don't want to pass up this opportunity to try that, right? To push in that direction. But because of it's so challenging in the context of the SIB, we maybe, I think if it ends up being that the SIB is, or Pay for Success, works under such unique circumstances, right? Where these contingencies aren't as big a concern, or the way it's structured, or the social investors not so worried about the risk returns. If it is going to be so specialized, we need another different type of mechanism, right? Which still achieves that goal, which I think is a really valuable goal. And then, in terms of success factors, I think I'm hoping to learn more from everybody here, those who have had experience, those who have been wrestling with those challenges, because I think that that's something that we're still pulling out of literature, right? We've seen, we're still learning, and this is another conversation we've been having over the last couple of days, this idea that, we are in the public sector, and there's this continuous expectation, show results, or we got to move on to the next thing, right? We know this is even harder than a lot of things we've tried to do. And we also are going to expect to have more failures, right? Or more, like I was saying, more just saying, we're trying. We think there's some valuable things in doing this. We're not getting there. Does that mean it's a failure? Or does that mean like we've learned something in the process and maybe we're going to do something slightly different, right? So that was kind of very like, social impact bonds or something like that, right? Maybe we won't get to an actual formal SIB, but we'll come up with an alternative arrangement that has some of those elements of a SIB, and will be successful because we will have advanced our focus from short term to longer term, or we'll have learned things along the way. We've actually, from the experience, we've improved our model, or as one of the project leaders was describing to me how through this process, even though they weren't funded, they were learning to build a coalition across a broader political spectrum, right? We now have, we think about who we have to convince that's worthwhile investing in early childhood in a different way than we did before. So we're talking to people in the private, we're talking to private businessmen. We're working with we're identifying who these players are. So these all might be elements of success that lead us to ultimately having more and better, in this case, preschool slots, right? Providing more early education for children. Not necessarily in the context of SIB, but we've taken certain elements from this effort and we've made advances. Or we've come to a compromise. It's not a SIB, but we've taken the blueprint for SIB. We've pulled out some elements that are achievable in this context. So maybe it's going to be more like let 1,000 flowers bloom, right? Rather than getting to the ideal SIB or the one model that everybody should be doing that the government's going to say, okay, we figured it out, everybody do this and it's going to work. I'm guessing that's not going to happen. And then we have to ask you to articulate a little bit one more time, like your question.
Thank you. So if government has difficulties finding enough providers to create a competition for a SIB,
yeah.
I was wondering if it is because of they usually either start from a project idea provided by one of the providers and therefore limiting the market, and how many are really starting from a clear definition of what the problem is and with a very open call to solutions.
Yeah.
Because there's always an interaction between all players in the need for success.
Mm-hmm. So from what I've seen from the intermediaries that I've interacted with, so actually one of the intermediary who was the player in these contracts and who I think has been most active in the U.S. actually got in touch with me a number of years ago when they were interested in developing a contract with a particular local government and said to me, well, we see you've done research on, outcomes-based contracting. Can you tell us more about it? And I was like, wait a minute, don't you guys know a lot about this already? But they were kind of just sort of getting into it. So they were literally trying to develop this expertise, right, in being this intermediary that pulls things together. So, I mean, I think that goes to the question that was asked earlier about, can you have like a few really specialized, or can this be a very specialized sector of new type of organization that just does intermediaries? Or can intermediaries be, the government? Can the intermediary be a local organization that specifically, like you were suggesting, develops capacity around a particular project? And I think that's another thing that we still don't know. If we just have an intermediary, like I was saying, that comes to, from their knowledge, a particular model and tries to put that same model on every project, whether it fits well or not, I don't think that's really advantage. So I do think that it is important to have competition in that sector if this is going to be a model that's used more widespread, because one model might not be the best, or one way to develop those capacities might be the best, and we may need to have, and like I said, if legally it's required in some states, for example, in the U.S., that you have the competitive procurement, then it's not going to work unless we develop more with capacity to compete for these roles in these contracts.
Thank you. I think we don't have time for further questions. We have a coffee break. You can catch Carolyn in the hall to ask all your questions. And we reconvene at 11:45 for a series of talks in plenary. Thank you.